Since the early weeks of the COVID-19 pandemic in the United States, health experts have emphasized the importance of testing. More recently, testing capacity and speed have increased, but so have the daily numbers of infections in most of the country, including Massachusetts. Those are the main reasons why Mayor Walsh has called for everyone in Boston to be tested. To tell us about the strategy and the testing pledge is the Mayor's Chief of Health and Human Services, Marty Martinez. Thank you very much for being with us, Chief.
Thanks for having me, Chris. Glad to be here.
I want to start with the whole strategy around testing. Anybody can say that, yes, if you do more testing, you have more information about who has infections, but what happens after testing that makes it so useful?
Yeah, no, it's so important that not only do people get tested, but what comes after it is so important. So once you get tested, if you unfortunately test positive, then all the work that comes from it is really meant to try to contain it. So a contact tracer, a public health professional reaches out to that person who tests positive, tries to find out who their close contacts are, and then contacts those folks to try to encourage them to get tested and also for them to quarantine, making sure that they don't infect others. So it's sort of a domino effect. It sort of helps you to understand how to get care for yourself, but then it's also helping you protect others that you may have been around and potentially have exposed.
Well, I know this is a general advisory about testing, but the city has also done mobile testing, and it's free, and in at least a limited number of locations around the city, East Boston, Mattapan. What was the strategy around that?
Yeah, I mean, absolutely. Our community health centers, for example, have done a really good job of making testing accessible at their sites. And we have sites all across the city where you can get tested. But we also wanted to pull up mobile testing options to bring testing into neighborhoods that may have been harder hit or neighborhoods that needed to increase their access. So right now we're in East Boston and Mattapan. We also have some sites in Dorchester that we're going to with health center partners. And then we'll be moving those sites sometime next week to another neighborhood. So the goal is to make it accessible, make it low cost, free mostly for most people, and to make sure that there's access in neighborhoods and access to where people already are. And that's been a really important part of us dealing with the pandemic along the way.
By the way, is there anything you can say so far about the response to those free testing sites or any of the follow-up?
Yeah, I mean, so far, obviously these mobile sites have been going for quite some time, but since the mayor's pledge, we have seen a little bit of an uptick in the number of folks getting tested. We've gotten more calls and more questions about testing have been coming in, which is important. We're still in a place, and nationwide this is true, where there's not 100 sites and it's not just, completely accessible everywhere you turn. There's still a little bit of work to be done to get tested. And so because of that, we really want to make sure that people have access not only to the information that's accessible on the city website, but also to locations and sites. So we've seen an uptick, which is good, and we want to keep seeing people get tested, especially as we see an uptick in COVID activity in the community.
Well, it's not new that the city has been giving attention to areas that seem to have the most disturbing figures, but in general, figures throughout the state have been more disturbing. There are some parts of Boston, especially Dorchester, East Boston, where they seem to be persistently high.
Right.
What do you think is going on there?
Yeah, I mean, it's a combination of things. There's just not one single thing that's created some of that uptick, but it's a combination of folks. We see different populations. We have a younger population, under 39 is where the majority of new cases are from. The Latino community has seen an increase over the past several months, which again is a disproportionate impact on a population that we're focused in. But it's everything. It's essential workers who are having to go to work. It's folks gathering in their homes and informally, but still potentially having people that they don't live with, interacting with. And so there's lots of different reasons for the uptick, but what is clear is we are seeing not only more positive tests each day, more activity in our hospitals and our sort of our emergency room, and overall we are seeing somewhat of an uptick in the community.
If you were able to get the numbers down far enough, it would be possible to at least partially open schools for in-person learning. But there seems to be a change in the notion of what kind of numbers you need for that. What can you say about that sort of a shift?
Yeah, I mean, definitely on the state levels, people may have seen that they sort of have shifted a little bit on, sort of their metrics and what they're sort of monitoring and what they believe is or is not suitable. Here in the city, we continue to look at the data. We continue to make sure that we're monitoring it. And there's no question the mayor and the superintendent and so many of our families are eager to have our students back in-person learning. So we need to make sure we can do it in a safe way, that we can do it in a healthy way. Even with COVID, I've said this multiple times that we have to live with COVID, and living with COVID means we have to make sure the precautions are in place, people can get tested, but also life and many of those things that need to continue, like in-person education, can continue. So we're still monitoring the data. We're working with our school partners and trying to do our very best to get our kids back into school.
Chris, one of the other things that has always complicated the matter is that the governor might make a reference to figures for Boston as a whole, but there's a discrepancy between the average for Boston
Yeah.
and the neighborhoods where most of the students in the schools come from. So how do you balance those?
Yeah, I mean, we balance it because we as a city have always looked at our metrics a little bit differently. We dig into them in a way that a community can do because we're a municipality, unlike the state, who's got to look at obviously many cities and towns all across the Commonwealth. So for us, we're able to dig into the data. So we dig in terms of testing. We separate out college student testing because there's so much of it. Really, really important, but it can skew the data a little bit. So we dig into the numbers, but as the pandemic evolves, and this is true, no one's been through this before, right? So as the pandemic evolves, the data, how you're looking at it, how you calculate it, also has to evolve. And again, you have to make some difficult decisions, but you need to really do it looking at the data and the science and let that steer you.
Speaking of the science, we have some good news about development of a vaccine. How good and how soon is this coming into play, you think?
Yeah, I mean, it was great news. I mean, to be able to hear that Pfizer believes that has a 90% effective rate of their vaccine through the trials, and that still needs to all be checked. But that's a really good news, a very high rate of effectiveness. And what that means is that the higher the rate, the more likely it can get approved sooner. But it's likely still several months, if not 6 to 8 months, before there'd be widespread distribution for a vaccine. And so it's good to see the news come out. It's also good to think about that system from the federal government to the state to the local and the work we have to do together to get ready for vaccine distribution while we're still in crisis response. Because for many of our communities, there's still an inequitable impact that we can't lose sight of, even if we're planning for a vaccine that still may be 6 to 8 months away.
Well, because of the election results, we now have the beginning of a transition to a new presidency. And the first thing that Biden and Harris have decided to do is set up a task force on COVID-19, a very different cross section of expertise here. How does this matter for Boston?
Yeah, I mean, there's no question that from a local government perspective, we've worked very closely with the state and have had a really strong relationship with the state. But to have a federal government partner here is going to be really important. We've been able to try to do our work in collaboration, but to see the transition team filled, the task force filled with scientists and doctors who understand what we're going through, too much of some of the COVID precautions have become politicized. And as a public health official myself, I'm really focused on the science, the data, and what we need to do to slow the spread and contain it and do everything we can to keep people healthy and safe. So I was glad to see who's on the task force. I was glad to see some of the credentials that are there, and I'm eager for us to have a really strong federal partner as we continue to combat COVID-19.
I know in the run-up to the election, there was this focus on the federal government as far as how it intrudes itself into states on strategies around COVID. But what about leadership as a way to get more resources for states that are struggling with this?
Yeah.
Do you see this being different?
Yeah, I do see it being different. I mean, I think part of the challenge has been, even when you think of something like testing, so much of the testing infrastructure that's on the ground in Boston or in neighborhoods is on the ground because of work that the city's done in partnership with health centers and hospitals, as well as in partnership with our state and the role that state government has played. So much of those resources that are made available have really been done through us figuring out how to prioritize, how to partner, and for the health centers who've really stepped up in a really important way. So that's been great, but to have more resources from the federal government will be critically important, not just to do it now, but to continue over the next 6 months, which will be needed, as well as the impact that it's had. You know, our businesses have struggled, small businesses have struggled, employees are struggling. And so we really need some additional federal resources to be able to help us navigate this and continue to mitigate the impact.
I want to come back to the mayor's advisory on testing because it is for everyone, but the city has also said there are certain people with certain situations who really should be tested. So clarify a little bit.
Yeah, I mean, the notion is this: if you are, symptomatic or you have any thoughts that you have symptoms related to COVID, you absolutely should get tested. If you are also exposed to other people who may have COVID or who are symptomatic, you should definitely get tested. I think it's this third bucket that sometimes we lose a little bit of sight of. If you're getting exposed to just people in general that you may not know if they have COVID, we encourage you to get tested. So that means if you're having informal gatherings in your home, or you're going out and connecting with people that are not in your bubble, if you will, or that you're frequently having to leave your home because you're either working or you have to do everyday sort of things, but you're exposing yourself, that means you're at risk. That means that you could get coronavirus. We're clear that if you're spending 15 minutes of time throughout the course of a day within 6 feet of someone, it means that potentially you're getting exposed. So we're encouraging people to get tested and to make sure that they're thinking about and know their own status, but also how it impacts those around them.
Along with getting the flu shot. So if people need some more details on advisories, you got the website they can go to?
Yeah, if you go to boston.gov/COVID-19, I believe, but if you just go to the main homepage of boston.gov, you can easily find the information, not only where to get tested, but also information about symptoms and all the other precautions that you should take.
Thank you very much for taking the time to join us.
Thanks, Chris. Appreciate it.
That was the Mayor's Chief of Health and Human Services, Marty Martinez. We'll have more news in just a moment.